How do Parkinson's neurological assessments work? Imagine trying to solve a puzzle where each piece reveals a little more about what's happening inside the brain. That's essentially what neurological assessments for Parkinson's disease aim to do. These assessments are a detailed way for doctors to understand the motor and non-motor features of the disease, track how it progresses, and help distinguish Parkinson's from other similar conditions. They combine careful physical exams, standardized rating scales, and sometimes specialized imaging tests to create a complete picture. The diagnosis of Parkinson's disease is primarily based on clinical judgment. This means doctors look for specific signs and symptoms through observation and examination, rather than relying on a single lab test. The key feature they look for is bradykinesia, which is a slowness in starting movements and a reduction in the speed and size of repetitive movements. For a diagnosis, bradykinesia must be present along with at least one other feature, such as muscular rigidity or a resting tremor that occurs at a frequency of about 4 to 6 times per second. These core signs help doctors differentiate Parkinson's from other movement disorders. During a neurological exam, the doctor performs several specific tests. One common test is finger tapping, where the patient quickly taps their thumb and index finger together. The examiner watches for any slowing or reduction in movement size, especially over time. They do this on both hands because Parkinson's often starts on one side of the body. Another test is pronation-supination, where the patient rotates their forearm back and forth rapidly, again looking for slowing or decreased movement. For the legs, the toe tapping test involves sitting with feet on the ground and rapidly tapping the toes. Reduced speed or amplitude here can also be a sign. Rigidity is checked by passively moving the patient's joints through their full range of motion. The doctor gently flexes and extends the wrist, elbow, shoulder, knee, and neck to feel for increased muscle tone. A stiff or rigid feeling indicates the presence of muscular rigidity, which is common in Parkinson's. Resting tremor is observed by watching the patient's hands, arms, or legs while they are at rest. The characteristic tremor occurs at a frequency of about 4 to 6 times per second and often begins on one side of the body. Before starting formal tests, doctors often observe the patient during conversation. They look for spontaneous movements, hand gestures, blinking rate, and involuntary movements. Reduced spontaneous movement, fewer hand gestures, and decreased blinking are typical signs seen in Parkinson's. To quantify the severity and progression of symptoms, doctors use standardized rating scales. The most common is the Unified Parkinson's Disease Rating Scale, which covers mental state, motor function, and daily activities. It assigns scores from 0 to 4, with higher scores indicating more severe symptoms. This helps track changes over time and evaluate how well treatments are working. Another useful scale is the Hoehn and Yahr staging, which classifies the disease from early, mild symptoms to advanced stages with significant disability. The Schwab and England Activities of Daily Living Scale measures how symptoms impact daily tasks like dressing or eating. While clinical examination is the main tool, imaging tests can support the diagnosis. One widely used test is the DaTscan, which involves injecting a radioactive tracer that binds to dopamine transporters in the brain. Since Parkinson's disease involves loss of dopamine-producing neurons, the scan shows reduced signal in the striatum, a key brain region for movement. Studies have shown that DaTscan has high sensitivity for Parkinson's, meaning it can reliably detect the disease and help distinguish it from other conditions like essential tremor. MRI scans are also used to rule out other brain abnormalities or structural issues that might mimic Parkinson's symptoms. Emerging imaging techniques like positron emission tomography scans using fluorodopa or fluorodeoxyglucose can provide detailed information about dopamine production and brain metabolism. Transcranial ultrasound and advanced MRI methods like nigrosome imaging are also being explored for their potential to improve diagnosis. Sometimes, analyzing cerebrospinal fluid for abnormal proteins like alpha-synuclein can add supporting evidence, though these tests are mainly used in research settings. Blood tests and other laboratory evaluations help exclude other causes of symptoms, such as thyroid problems or vitamin deficiencies. The entire process of diagnosis combines these tools and observations. A healthcare provider begins with a detailed history and physical exam, focusing on the presence of bradykinesia and other key signs. If the clinical picture is clear, additional imaging may not be necessary. But if the diagnosis is uncertain, or if symptoms are atypical, imaging tests like DaTscan or MRI can provide valuable support. Repeating rating scales over time helps monitor how the disease evolves and how well treatments are managing symptoms. These assessments are vital because they guide treatment decisions, help predict disease progression, and identify complications. They also enable patients and families to understand what is happening inside the brain and how best to manage the condition. Remember, every person with Parkinson's is unique, so assessments are tailored to individual needs. Always consult healthcare professionals for personalized advice and diagnosis. These tools and techniques form a comprehensive approach to understanding and managing Parkinson's disease, ensuring patients receive the most accurate and supportive care possible.